everybody. Welcome back to Talk Doula To Me. We are so excited that you are listening tonight. We're so excited you're here. And we have a super special guest for you. Tonight, we have Kristine Sweatt. She is one of our local massage therapists. Welcome, Chris. I'm so excited you're here.
Thank you very much. Thank you for having me, Nicole. I appreciate it.
Absolutely. So let's jump right in. For many of us in the community, we have pregnant moms listening, we have couples listening. We might just have the everyday person that's like massage therapy. Tell me a little bit more about that. So jump in, tell us about you, about what a massage therapist is, and then how the community goes from there using your services.
Okay. Well, I am a Florida native. I live in Sebastian. I do have an office down in Vero off of US 1. That is my location. I will come to your house. Obviously, there's a travel fee for that, but we can discuss that. And massage therapy is basically soft tissue manipulation, meaning I use my hands and sometimes tools of the trade, if you would, to manipulate, soften, loosen muscles, fascia, connective tissue, tendons, those types of things to help you really reduce stress. It increases your circulation, both your blood and your lymphatic system, and it increases relaxation. Those are the biggest takeaway points that people need to know.
Awesome. Very, very cool. And I also have my friend Kristen, and we're doulas. Hi, Kristen. I'm so happy you're with us tonight too. So we work with a lot of pregnant mamas, right, in the community. So we have moms come to us and say, can I get a massage? Is it good to get a massage? When can I go? Is it ever too late? Does it hurt the baby? So let's talk a little bit more about that with prenatal massage, being pregnant, and then after mom gives birth and then is healing, when does she come to you?
So the standard is after the first trimester, and that really is more of a safety precaution. I think because pretty much everybody knows that first trimester is the most critical and the most risky portion, once you get closer to the end. So really, as a massage therapist, we don't like to work on anybody that is still in that first trimester. So we're considered, once you're out of that first trimester, you're good. Unless you have some serious other issues besides pregnancy going on, there really aren't many more contraindications for massage therapy. The biggest thing and the biggest benefit that a mom's going to get prenatal, it's going to improve your sleep. It's going to decrease the stress hormones that your body is going through, and we can help you decrease your back and leg pain. A lot of leg pain is due to the anticoagulants that start forming in the blood so you don't hemorrhage during birth. And that slows the blood flow down in the legs, which just kind of makes everything stale. And massage can actually help move that to where it's supposed to be and get some circulation down there in those legs.
Okay. Is that all the way up to 9 months? Is that up to birth? How does that work?
Up to birth and beyond.
Okay.
Yes. So, and as far as the frequency, that's really dependent on your budget. People, I've had a few ladies come in once a month, and then as they get closer to delivery, they've ramped it up to once a week. So like I said, really that's just a matter of your finances and what you can afford.
That's cool.
What would you say is the biggest ailment that you treat or the biggest complaint that you hear from pregnant mamas?
That would be low back pain. My back hurts. The baby's sitting on my sciatic. Those are the two biggest ones. And, when we're working on the table, sometimes you can lay on your belly, but for the most part, for the comfort of the mama, I usually have her lying on her side with some pillows. So she's kind of all cuddly on a bunch of pillows. And we just work and we talk, and she lets me know, okay, that's working, that's not working, that feels good. As long as our communication is there, she's going to get the relief that she came to me for.
Is that, or would that be instant relief then? Or do you usually, with moms that are listening that are like, that's me, I suffer with that. Is that I have to go for a couple months for it to have any relief? Is it instant relief? Usually, what are the experiences of these moms coming in?
I'm going to say probably 75% are going to find instant relief. Because they're relaxed, they're in a relaxing environment, and especially after the first session with me and the mom, we're bonding as well. So then when they repeat and they come back to see me, now they're a lot more comfortable with me. They know me, I know them, and then at that point they can really relax and let me do what I'm supposed to do. And that's get in there and, it may be moving her around a little bit on the table, to really get into the areas that she needs work on.
Okay. And are we talking hour-long sessions? Do you do half an hour? What does that usually look like?
Those are typically an hour. I've done a couple hour and a halves, but they tended to go back to an hour session. They felt with their pregnancy, the hour and a half was just a little bit too long. So an hour seems to be the most beneficial time period on the table.
Very cool. And Chris, do you have kind of like a favorite success story? Maybe like someone came, like a mom came to you and you're like, wow, she has a lot going on and you really feel for her, but you were able to work her through all of these struggles.
It's funny that you asked that, because yes, I do. This one lady in particular, and she had some serious low back issue, and she had just kind of been fighting with it, and it was her first pregnancy. Oh, this is just part of it. I'm just going to have to suffer through it. And I'm not exactly sure how she got my number, but she brought her in. We had our first session, and I did some stretching on her as well as massage, and she was in tears because it was instant relief for her. On the table, she did not even have to get up. She's like, I don't feel that pain anymore. And that was, I think we cried a little bit, but it was, it's really special. So
very powerful.
Yeah.
Oh, that's wonderful. That's wonderful. That gives me a really good view, if I'm a listener, of kind of from walking into the door to that hour, what's taking place, where am I? Because so many different people are like, well, I don't want to go into the office because I don't know what I'm going to have to do. Is it going to hurt? Are they going to be kind? Is it, things like that. So it's good that you give that great picture of what it's like to walk through a session with you, kind of that from start to finish. Now, is this a thing where, I only go when I have a problem? Or is this more preventative, like to prevent problems? Tell me a little bit about that lifestyle of, go using a massage therapist.
Massage therapy has been used for centuries. And I think we all know that. And it really does need to be put into your little toolbox of preventive maintenance. You know, just like you go get your teeth cleaned, just like you go get your skin checked, you know, at your dermatologist. This will prevent and just help you stay more relaxed and focused. And there's been several times that I've been able to find some cancer on some of my older folks, some skin cancer.
Wow.
Because it's in areas that they don't see, like their back or the back of their legs. And these are people, some of them I see every week. And so it's like, oh, hey, I'm going to keep track of this. If it gets bigger, you know, you need to go see your dermatologist. So use me like a, you know, healthcare provider.
Absolutely. And Kristen, you and I were chatting the other day about this, but you know, does our insurance cover this? Could we ever get this prescribed to go see a massage therapist? Does that ever happen? Or does this come directly out of pocket?
Sometimes, if you ask your doctor, he could possibly recommend and write you a prescription for a series of massages. So yes, it is something that some health insurance companies do cover. So depending on what your out-of-pocket costs are, I do accept insurance. So, you know, that's not a problem. You get your paperwork from your insurance company, bring it to me, I fill it out, and you're good to go there.
That is so wonderful. And Chris, how do people reach you? How should we reach you if we're watching today? How do we get to you?
Well, you can go to my website, which is soothinghealingmassage.com. You can reach me on my phone, either call or text 863-697-3773, or you can email me. It's Kristine Sweatt at gmail.com. And I believe those are going to be up at the end also. So that way there's no spelling mistakes.
Yes, absolutely. Absolutely. Well, Kristen, I loved having you tonight. You know, you're my tag team partner, so it's awesome that you were here. Chris, you were such a blessing to us tonight. We're so thankful for the gifts that you bring to the community, the way that you serve people. It's huge. We need you. We're thankful for you. And we just wish you lots and lots and lots of successful work for a very long time. So thank you, thank you, thank you. And thank you everyone for watching tonight, and we'll see you soon.
Bye.